I'm Brett Baer in Washington, and this is a Fox News alert. Potentially a game changer. New Jersey Governor Christie apparently knew about the lane closings dubbed Bridgegate. That's according to a letter from the Port Authority official who personally oversaw the closings. This would fly in the face of multiple statements Christie has made, steadfastly denying he knew anything of the sort. And in just the past few minutes, the governor's office has released a response. Senior correspondent Eric Shawn is live with the breaking details from New York. Good evening, Eric.
Good evening, Brett. He lied, and there's evidence to prove it. So says the lawyer for a former top official about Governor Christie's claims concerning the George Washington Bridge lane closures. The governor denies he knew that the order from his former deputy chief of staff, Bridgegate Kelly, was supposedly political payback against a Democratic mayor. Mr. Christie says he never even knew about the closings until they were over. But now the governor is accused of not telling the truth about that. David Wildstein was a Port Authority official who oversaw the closings. He took the fifth before a New Jersey State Assembly committee hearing about the scandal. He's the one who got that email from Kelly ordering the closings. Well, his lawyer, Alan Zagas, wrote today, quote, "Evidence exists as well tying Mr. Christie to having knowledge of the lane closures during the period when the lanes were closed, contrary to what the governor stated publicly in a 2-hour press conference he gave immediately before Mr. Wildstein was scheduled to appear before the Transportation Committee. Mr. Wildstein contests the accuracy of various statements that the governor made about him, and he can prove the inaccuracy of some. This is what Mr. Christie claimed in part on January 9th.
I had no knowledge of this, of the planning, the execution, or anything about it. And then I first found out about it after it was over. And even then, what I was told was that it was a traffic study. And there was no evidence to the contrary until yesterday.
Well, in a statement tonight, Governor Christie's office says the letter supports him. Quote, Mr. Wildstein's lawyer confirms what the governor has said all along. He had absolutely no prior knowledge of the lane closures before they happened, and whatever Mr. Wildstein's motivations were for closing them to begin with. The governor denies Mr. Wildstein's lawyer's other assertions. Well, the letter does not say Mr. Christie knew the closures were done for a political retribution, but it does come as a slew of material subpoenaed by the New Jersey State Investigative Committee is due on Monday. The lawyer for Christie's former campaign manager and top political aide, Bill Stepien, today asked the committee to withdraw his client's subpoena, saying that it violates his rights. Meanwhile, public hearings are expected to start in Trenton on all of this in the next few weeks. Brett?
And Eric, just to be clear, this letter from Wildstein's lawyer says evidence exists that the governor knew. It doesn't say, number one, what the evidence is, or number two, if Wildstein actually has that evidence.
That's correct. We don't know if it's potential emails, recorded phone conversations, or what this evidence is. This, though, likely could all start coming out when these hearings start, expected in a few weeks.
Okay, Eric Shawn, thank you. More on this with the panel. Now to another story. The biggest objections to the Keystone XL oil pipeline were always environmental. Late this afternoon, the State Department released its report, which should put many of those fears to rest. As White House correspondent Wendell Goller reports, final approval is still a ways off, but supporters do have a case for optimism now.
More than 2 years after the Obama administration put the Keystone XL pipeline on hold, the State Department has completed an environmental impact statement on the pipeline's new route. It doesn't make a recommendation, but raises no environmental objections. The White House denies it is delaying a project opposed by environmentalists.
These issues are complex. They require the sort of rigorous approach and assessments that are being undertaken by the State Department. And that is what it is.
On Capitol Hill, most Republicans and some Democrats disagree. Senate Minority Leader Mitch McConnell said in a written statement, quote, Mr. President, no more stalling, no more excuses. Please pick up that pen you've been talking so much about and make this happen. The American Petroleum Institute's Cindy Schild notes the Keystone project had been underway for several years when the administration essentially put it on hold.
We may be looking at 6 years. Every single other pipeline project similar in nature has been approved in 2 years or less. So this has just become about politics.
Earlier this month, the president heard from the leaders of 18 environmental groups who oppose the pipeline and who said his all-of-the-above energy policy is fundamentally at odds with his goal of cutting carbon pollution. It forced his spokesman to defend Mr. Obama from a group that had been largely supportive.
We have reduced carbon pollution in this country under the president through the historic emissions standards that have been set and other steps that have been taken and will be taken.
The president says he'll consider the impact on global warming as part of the decision to build the pipeline, though the report suggests without a sharp decline in the price of oil or an increase in the cost of transporting it, the Canadian oil will likely be extracted one way or another. Sandy Schild agrees.
This is one pipeline project, and Canada's certainly not going to be leaving their greatest valued resource in the ground.
Canada's Natural Resources Minister weighed in late today. He said the choice is between getting oil from a reliable, environmentally friendly neighbor or from unfriendly sources with lesser standards, and he suggested the decision ought to be an easy one. Brett?
Wendell Goller live on the North Lawn. Wendell, thank you. President Obama still hopes Congress will pass comprehensive immigration reform, but he's keeping that pen and phone option on this issue on the table.
It is my firm belief that we can get immigration reform done this year. If at some point we see that it's not getting done, I'm going to look at all options to make sure that we have a rational, smart system of immigration.
He made those comments during a Google Plus hangout this afternoon. He also said he's in favor of net neutrality, in other words, a free and open internet. He suggested the FCC would push for it. Now, critics of net neutrality say broadband networks have no plans to block content. Republicans and Democrats, lawmakers up on Capitol Hill, agree on one thing. The Obamacare rollout was a disaster, but even after some fixes, it's still not popular. Republicans are working on their own idea to replace the Affordable Care Act. We have Fox team coverage tonight. Jim Angle looks at hospitals considering paying the premiums of uninsured patients. But first, Chief Congressional Correspondent Mike Emanuel is live on Capitol Hill with the latest today. Hi, Mike.
Well, Brett, good evening. Amid signs that Obamacare remains unpopular with millions of Americans, House Republicans are looking for the best way to replace it.
We understand that people are hurting, and we understand that there needs to be a replacement, that we need to fix in our health care system, but not do it in a way that puts government in charge.
At the House GOP retreat in Cambridge, Maryland, leadership discussed with rank-and-file members moving forward with an Obamacare replacement to provide a contrast.
There was a lot of support for the purchase across state lines, making so that greater access for differing types of health coverage. Health savings accounts, absolutely. So many of those fit people's needs from a health care standpoint, and right now they are either decreasing or becoming illegal.
Price is an orthopedic surgeon and is one of the lawmakers who has proposed an alternative. House Democratic leader Nancy Pelosi, one of the architects of Obamacare, had to defend healthcare.gov on a late-night comedy show because it hasn't been fully repaired and there are still major back-end technical problems.
Why is it so hard to get a company to execute that competently?
I don't know. And as one who works very hard. No, and that's my question.
Well, let me get the House Minority Leader here. I can ask her. Hold on. No. Wait, what do you mean you don't know? How do you not know?
Yet a Kaiser Foundation poll shows the law is still unpopular with the American public. The uninsured oppose it by almost 2 to 1. And 30% of the uninsured believed Obamacare has made them worse off than before. On a Google Hangout today, President Obama promised results for a woman who says she cannot keep a plan and specialists she liked and is overwhelmed by red tape.
Since you're talking to the president directly, we'll get, I guarantee you, a firm answer by the end of the day.
An Illinois Republican said some of the fixes for Obamacare are pretty obvious.
Some of these things, they're very common sense, and the president again falls into this trap of, hey, you either like my approach or you don't want to do anything at all. And I think most folks are now seeing through that.
An analysis by the Center for Health Economy of a Senate GOP alternative offered by Richard Burr, Dr. Tom Coburn, and Orrin Hatch reveals their Patient Care Act would save almost $1.5 trillion over 10 years. That study also suggests the Senate GOP plan would reduce health care costs, lower premiums, and provide health care coverage to more Americans than Obamacare. Brett?
Mike Emanuel live on the Hill. Mike, thank you. At a time when the Obama administration is desperate to sign up more patients for Obamacare, one group has come up with an unusual plan for enrollment that is extremely controversial. Here's Chief National Correspondent Jim Angle.
In an issue that has divided hospitals and insurance companies and ignited a debate inside the Obama administration itself, hospitals are considering actually paying the premiums of uninsured patients who land on their doorstep.
There will still be many uninsured people, even with the health care reform law. And so hospitals are worried about the uncompensated care that they'll have to pay.
So someone raised the novel idea hospitals could actually pay the Obamacare premiums for people in their care, so they'd have insurance to cover their bills. The American Hospital Association said some members worried that Obamacare would be too expensive for many and, quote, recognizing that an individual's share of the cost of a premium may be prohibitive even with a federal subsidy, several hospitals have inquired whether there are any legal barriers to providing premium assistance.
To actually help pay their premium, to subsidize for them the cost of health insurance.
There was one potential legal barrier, but on October 30th, the Health and Human Services Department ruled paying premiums would not violate a key federal law. But then on November 4th, the Centers for Medicare and Medicaid took a different tone, warning hospitals about paying for premiums, saying, quote, HHS has significant concerns with this practice because it could skew the insurance risk pool and create an unlevel field in the marketplaces. It also said HHS discourages the practice and insurance companies agree.
That's why there's an individual mandate, for example, to incentivize people to purchase insurance rather than waiting until after they need medical care to buy insurance.
But the American Hospital Association issued a statement to Fox saying, quote, we think hospitals should be able to provide premium assistance because these patients are the ones who need it most, and we want to make sure they have adequate coverage. It also said that would enable future patients to receive care earlier, perhaps at a doctor's office, avoiding the need for hospital care. But even beyond skewing the risk pool, insurance companies have many objections.
The issue here is that when the entities that are paying premiums and cost sharing are doing it solely to benefit themselves financially, that's a conflict of interest, and that's something that shouldn't be done.
Now, in the midst of so many different views, Brett, analysts say it may take the courts to make a definitive decision. Brett?
Okay, Jim, thank you. A rough day on the markets today. The Dow lost 150. The S&P 500 fell 11. The Nasdaq dropped 19. For the week, the Dow lost over a percentage point. The S&P slid just under a half point. The Nasdaq was down over a half. Up next, who is, excuse me, and is not cashing in on the Super Bowl. But first, here's what some of our Fox affiliates across the country are covering tonight. KRIV in Houston has the return to port of the cruise ship where more than 170 passengers and crew fell ill from a fast-spreading norovirus. This is the second cruise this week to be cut short by the contagious bug. Fox 13 in Tampa is covering the elderly woman who is being held without bond for repeatedly feeding the bears. And this is a live look at New York City's Super Bowl Boulevard. The big story, of course, from our Fox affiliate WNYW, the frenzy over Sunday's championship game. The Pentagon, we're told, will use fighter jets, military fighter jets, to patrol the area around MetLife Stadium to enforce the FAA's temporary flight restrictions there. That's tonight's live look outside the Beltway from Special Report. We'll be right back.